Have you ever sat alone on a quiet evening, holding your aging mother's trembling hand, wondering if something were to happen to her tomorrow, would you be able to give her the care she truly deserves? As physical health, loneliness, anxiety, and the stress of uncertainty can weigh heavily on aging parents, especially when medical needs become a regular part of life. The right health insurance plan must address not only the tangible costs of treatment and medication, but also provide support systems that foster a sense of security and companionship. Start the conversation with empathy. Sit with your parents and truly listen, not just to their words, but to the silences between them. Ask how they feel about their current health, what worries keep them up at night, and what kind of care would make them feel most comfortable. Remember, this is not about imposing your ideas, but about understanding their wishes and respecting their dignity. Once you have a clear sense of their needs, begin researching the available options. Focus on plans that prioritize comprehensive coverage for seniors, including outpatient services, hospitalization, prescription medications, and preventive care. Look for plans that offer flexibility, allowing your parents to visit the doctors and specialists they trust. Don't overlook the importance of coverage for pre-existing conditions, a major factor for many elderly parents. Some plans may offer wellness checkups, telemedicine consultations, and even mental health services, which can be invaluable as they navigate new health challenges. Beyond the medical benefits, pay close attention to the support services included in each plan. Does the insurer provide a dedicated helpline for seniors? Are there care coordinators who can assist with appointments, medication refills, or even home nursing services if required? These services can make a world of difference when your parents need help the most. Another often overlooked aspect is the ease of use. Health insurance paperwork can be bewildering, even for the young and tech-savvy. Imagine how daunting it can be for your parents. Choose a provider with a reputation for excellent customer service, clear communication, and straightforward claims processes. Some insurers even offer digital portals or mobile apps tailored for seniors, simplifying everything from tracking benefits to scheduling appointments. Finances matter, of course, but don't make the mistake of choosing a plan based solely on the lowest premium. An inexpensive plan that offers little support or has sky-high out-of-pocket costs may leave your parents vulnerable in a crisis. Instead, weigh the monthly premium against the potential out-of-pocket expenses, coverage limits, and access to quality care. It's worth investing a little more if it means your parents will never have to hesitate when seeking medical attention. As you narrow down options, consult with an independent insurance advisor or a trusted family physician. Their insights can help you understand the fine print, compare benefits, and avoid common pitfalls. Some employers, banks, or community organizations also offer group health plans for seniors, which can be more affordable and comprehensive than individual plans. Involve your parents in every decision. Review the policy documents together, explaining what's covered and what isn't. Make sure they know how to reach their insurer, what to do in an emergency, and how to access regular care. If there are language barriers or difficulties with technology, set up reminders, print out contact information, or even arrange for a neighbor or relative to help out if needed. Securing the right health insurance is not a one-time task. As your parents' needs evolve, review their coverage annually. Changes in health, medications, or living arrangements may require adjustments to their plan. Stay updated on new products, government programs, or benefits that might better suit their changing circumstances. The impact of these efforts goes far beyond paperwork and premiums. It's the peace of mind that comes from knowing your parents are protected, It's the relief in their eyes when they realize they won't have to choose between their health and their savings. It's the quiet reassurance that no matter what tomorrow brings, they will be cared for with the same love and dedication they once gave you. Remember, aging is not just a series of medical appointments and health scares. It's a season of life with its own joys, hopes, and challenges. Your parents deserve to spend these years in comfort and security, surrounded by the warmth of family and the assurance that their well-being matters deeply to you. So don't wait for a crisis. Begin the conversation today. Ask your parents about their health, their concerns, and their wishes. Research the options, seek advice, and make a plan together. This is not just a financial decision. It's a profound act of love, a chance to honor your parents' sacrifices and give them the dignity they deserve in their golden years. In the end, the greatest gift you can offer your aging parents isn't just a policy or a plan, it's the promise that they will never have to face life's uncertainties alone. That, no matter what, you will be there, holding their hand just as they once held yours. And in that simple gesture, you remind them and yourself that family is not just about the past, but about the enduring bonds of care, respect, and love that carry us all through life's most challenging moments. When considering the well-being of our aging parents, it's easy to focus on the obvious medical needs, doctor visits, prescriptions, and emergency care. But beneath the surface, there are silent battles many elderly individuals face every day: loneliness, depression, and the fear of becoming a burden. Plans that offer mental health coverage can make a world of difference in combating these challenges. It's not just about treating an illness, it's about nurturing the spirit and ensuring that our parents feel connected, valued, and supported during a time when they might otherwise withdraw. Mental health coverage, often overlooked, is a vital component of any comprehensive insurance plan. For many elderly parents, the transition into retirement, the loss of lifelong friends, and changes in physical ability can trigger feelings of isolation and sadness. Access to counseling, therapy, and support groups provides more than medical intervention. It offers hope and a path to rediscovering joy. It helps them process life changes, encourages social engagement, and, most importantly, reminds them that they are not alone in their struggles. When we prioritize mental well-being, we acknowledge the full spectrum of our parents' needs, extending our care beyond the physical to embrace their emotional and psychological health. Equally important is the provision for comprehensive preventative care. Sometimes, the best way to heal is to prevent illness in the first place. Preventative care includes regular checkups, screenings, vaccinations, and early detection programs that can ward off more serious diseases before they take root. For elderly individuals, this can mean the difference between a manageable condition and a life-altering diagnosis. By choosing insurance plans that emphasize preventative services, families can avoid the heartache and stress that often accompany sudden health crises. Instead, they foster a proactive approach to wellness, one that empowers parents to maintain their independence and quality of life for as long as possible. But even the most robust plan can fall short if it isn't transparent. Too often, families find themselves blindsided by denied claims or unexpected expenses, all because of complex terms buried in the fine print. Transparency is crucial. When evaluating insurance options, clarity about coverage details is non-negotiable. Families should insist on straightforward explanations about what is covered, what isn't, and what can be expected in various scenarios. This knowledge isn't just practical, it's empowering. It prevents misunderstandings, reduces stress, and enables everyone to make informed decisions. This is where involving your parents in the conversation becomes essential. It might be tempting to handle everything on their behalf, especially if paperwork feels overwhelming or the terminology is confusing. But when we exclude our parents from these discussions, we inadvertently strip them of their agency. Including them in the process is a profound act of respect. It acknowledges their experience and wisdom, gives them a voice in shaping their future, and reassures them that their opinions matter. This sense of involvement fosters dignity and self-worth, transforming what could be a fraught process into a collaborative journey. The emotional impact of securing the right coverage cannot be overstated. I have witnessed families changed for the better once a suitable plan was in place. The burden of what-if lifts, replaced by a reassuring sense of security. Parents, who may have quietly worried about being a financial or emotional burden, regain their confidence. They know their children have taken steps to ensure their well-being, and that knowledge brings peace. On the other side, children, often caught between the demands of work, their own families, and caregiving, sleep more soundly, knowing they have honored their parents' legacy by protecting their future. Time, however, is a precious resource. Too many families wait until a health crisis strikes to consider insurance options, only to discover that pre-existing conditions have made affordable coverage unattainable. The window for easy enrollment narrows rapidly as health issues accumulate. That's why the best time to act is now, while choices are still plentiful and premiums are manageable. Acting early is an act of love, ensuring your parents have the security and care they deserve, without the added stress of scrambling for solutions in a moment of crisis. Perfection is not the goal. It's easy to become overwhelmed by the many options, each plan promising different benefits and protections. But don't let the search for the perfect plan delay you from making a decision. The right plan is not necessarily the most expensive or the most comprehensive. It's the one that aligns with your parents' unique needs, your family's budget, and your collective peace of mind. What matters most is that you take action, that you put something in place to serve as a safety net and a foundation for your parents' continued well-being. Years ago, after a frightening health scare in our own family, we finally secured a comprehensive health insurance plan for my father. The change was remarkable. No longer did he worry about every ache or doctor visit. He felt free to enjoy life again, to travel, to spend time with his grandchildren, and to pursue hobbies he had set aside. The confidence and joy that returned to his life were evident in every smile, every laugh, and every new adventure he embraced. It wasn't just about having access to care, it was about restoring his sense of freedom and dignity. This experience taught me a lesson I hold dear. Helping your parents find the right health insurance is not just about managing risk or covering medical bills. It's about giving them back the freedom to live their golden years with dignity, comfort, and peace. It's about honoring their sacrifices by ensuring they never have to face illness or uncertainty alone. It's about expressing gratitude in a tangible, meaningful way, protecting those who once protected us. So, I encourage you to reflect. If something were to happen to your parents tomorrow, would you be prepared? If your answer is anything less than an enthusiastic yes, let today be the day you begin this journey. Take the first step, start the conversation, explore your options, and commit to securing the future your parents deserve. In doing so, you not only protect their physical and emotional health, but you also strengthen the bonds of love and trust that hold your family together. This is how we honor the past, safeguard the present, and build hope for the future.